Dear friends, good morning. I think it's important for us to have a discussion on a critical topic, which in my view is seriously neglected. I'm thinking of the issue of adolescent mental health in Africa. A fundamental question is how many more African adolescents must die in silence because of mental health issues? How many adolescents must die of suicide because of underlying mental health neglected issues? And when are we going to prioritize adolescent mental health, not as a peripheral concern in our policies, budgets, and data systems? Added to the still prevalent rates of maternal mortality, in my view, the neglect of adolescent mental health, most especially or most importantly in Africa, is a critical sign or a litmus test of our failed health systems. The data is actually clear on this. The prevalence of adolescent suicide attempts in Africa is estimated at 9.9% amongst young people. And we actually have a lifetime prevalence of self-harm in Africa of about 10.3%. Adolescent suicide is a growing but under-acknowledged public health crisis in the continent. Alarmingly, suicide amongst young people range from 3% to about 42% in some cohorts. In Ethiopia, for instance, the pooled estimate of suicide attempts amongst Ethiopian adolescents and youth covering the age from 10 to 24 years was estimated last year at 12.8%. While each death is tragic, it also signals deep systemic gaps in mental health care, social protection, and youth empowerment. We say that the youth of Africa are the future of Africa, but young people are dying by suicide at alarming rates, often in silence and stigma. More adolescents who attempt or think about suicide are actually navigating environments that are marked by poverty, violence, poor mental health support, and social stigma. Some are survivors of abuse, others are living with HIV, dealing with substance use, or bearing the brunt of gender inequalities. Adolescent suicide in the continent is driven by a complex interplay of depression, anxiety, substance abuse, poor family and social support, exposure to violence, stigma, HIV status, body image issues, gender identity struggles, academic stress, socioeconomic deprivation, and a glaring lack of political will. Lack of data systems to actually document where we are when it comes to tracking our major indicators when it comes to mental health and mental health services to adequately respond to this growing crisis. We know that we don't have them fixed or the adequate number of psychiatrists. We know that the number of trained healthcare professionals, medical doctors, are not enough. But we also know that there are best practices in task shifting and task sharing that can address these concerns. It takes political will to make this kind of change. The science is there. And as they say, we need good science and good politics to make the change. There is no mental health if there is no health without mental health. It's important for the governments, for health systems to stand up for mental health and most importantly, adolescent mental health if you want to secure a healthy future and a productive future for Africa. Thank you.